Medical bills are the #1 cause of bankruptcy in America, even more than credit cards or mortgages. And the scary part? Most of those costs could have been reduced or avoided. That's why today, I'm going to show you simple tips and tricks that can save you thousands on your medical expenses every single year. Let's be honest, medical bills aren't something most of us like to think about. We usually just deal with them when they arrive, and by then it's already too late. But here's the truth. Being proactive with your healthcare expenses is just as important as taking care of your health itself. Think of it this way. Every dollar you save on a bill is a dollar that can go toward your family, your goals, or simply enjoying life. And you don't have to be a financial expert to do it. You're going to want to start with some really simple habits like asking the right questions, knowing what's covered, and catching mistakes before they drain your wallet. The best part? Once you get the hang of it, saving money on healthcare becomes second nature. At first, it might feel a little uncomfortable, like negotiating with a provider or double-checking a bill, but over time, it gets easier. And the confidence you gain will save you not just money, but a lot of stress too. So in this video, I'm going to show you practical, step-by-step ways to take control of your medical expenses. These are the simple tips you can start using right away. The challenge with medical bills. Let's be honest about why medical bills are so stressful. If you've ever gotten one, you know the feeling. Your stomach drops, your heart races, and you start asking yourself, how am I going to pay this? You're not alone. Millions of people face the same frustrations every day. First, the high costs. Even with insurance, it feels like prices keep climbing every year. A simple checkup, some blood work, or a quick x-ray can suddenly add up to hundreds of dollars. And if you have a deductible that's thousands of dollars before coverage even kicks in, it can feel like you're paying out of pocket for everything. Then there are the unexpected charges, the ones that sneak up on you. Maybe you go to the ER for something small, thinking insurance will cover most of it. But weeks later, a giant bill arrives in the mail, and you're left asking, where did this even come from? Sometimes it's because a doctor you saw was out of network, or a test wasn't pre-approved by insurance. But here's the problem. You don't usually find that out until after the fact. And of course, one of the biggest headaches of all, lack of transparency. Medical bills are written in codes and terms most people don't understand. You see line items like complex codes, facility fees, or miscellaneous charges, and you have no idea what they mean. It's overwhelming, and it leaves a lot of people just paying the bill without questioning it. But here's the thing. Studies have shown that a large percentage of medical bills actually contain errors. So many families end up paying for mistakes they didn't even know to look for. And when you add all of this together, it creates stress, anxiety, and even fear. People start avoiding the doctor, putting off tests, or skipping follow-ups just to avoid another bill. And in the long run, that makes things worse, both for your health and your finances. The good news is that while these frustrations feel overwhelming, they are not unavoidable. Once you know what to watch for and learn a few simple strategies, you can take back control and save money with medical bills. And that's exactly what we're going to cover next. Practical tips to save on medical bills. Tip number 1. Understand your insurance. I know this might sound obvious, but most people don't really know the ins and outs of their plan until a bill arrives. Take some time to learn your deductible, your out-of-pocket maximum, and which doctors or hospitals are in-network. Staying in-network can save you hundreds, sometimes thousands, on a single procedure. And don't forget, many insurance companies have online tools to estimate costs before you schedule a test or visit. Using those tools ahead of time can prevent surprise bills later. Tip number 2. Double-check every bill. Did you know that studies have found up to 80% of medical bills have errors? 8 out of 10. That means there's a good chance you've paid for something you shouldn't have. So when a bill arrives, don't just glance at the total. Look at the details. Ask for an itemized bill. You'd be surprised how often you'll find duplicate charges, services you never received, or incorrect codes. A quick phone call to the billing office can save you hundreds. Tip number 3. Negotiate. Yes, you can. This is one of the most powerful tips. Many people assume medical bills are set in stone, but that's not true. Hospitals and clinics would rather receive some payment than none. Call the billing office and ask, "Do you offer a discount if I pay in full?" Or, "Can we set up a payment plan?" Sometimes just asking can reduce your bill by 20, 30, or even 50%. And don't feel embarrassed. Billing staff are used to these conversations every day. Tip number 4. Shop around for care. Not all medical services cost the same. For example, the exact same MRI might cost $2,000 at a hospital, but only $600 at a nearby imaging center. Same machine, same scan, different price tag. If it's a non-emergency, call ahead and compare prices. Websites like Healthcare Blue Book or GoodRx can give you ballpark estimates so you know if you're being overcharged. Tip number 5. Focus on preventative care. This is where you save money in the long run. Skipping your annual checkup might feel like saving money now, but if it leads to a health crisis later, the costs are enormous. Most insurance plans cover preventative services for free. Things like vaccinations, screenings, and yearly exams. Taking advantage of those keeps small problems from turning into expensive emergencies. Think of it like car maintenance. It's cheaper to get an oil change than to replace the entire engine. Tip number 6. Know your tax advantages. Here's something a lot of people miss. Medical expenses can sometimes be tax deductible. And if you have access to a health savings account or flexible spending account, use it. These accounts let you pay for qualified medical expenses with pre-tax dollars. That's basically free savings built right into the system. Tip number 7. Look into financial assistance programs. Many hospitals have charity care or hardship programs for patients who qualify based on income. Even if you don't think you'll qualify, it's worth asking. I've seen people get 20, 30, even 50% of their bill reduced simply because they filled out a form. So, there you have it. You can try these 7 practical ways to take control of your medical costs. Small steps like these add up to huge savings over time, and once you start using them, it becomes second nature. Most powerful tip. Now, if there's one tip that can have the biggest impact on your medical bills, it's this. Don't be afraid to negotiate directly with your healthcare provider. I know, it can feel a little intimidating at first. Calling the billing office, asking questions, or requesting a discount might seem awkward, but this one step alone can save you hundreds or even thousands of dollars. And the truth is, providers expect it. They'd much rather work with you than send the bill to collections. Here's a real example. One patient received a $4,000 bill for an outpatient procedure. She thought it was already expensive, but when she called the hospital and politely asked if there were any discounts or payment plans available, the billing office reviewed her account and reduced the total to $2,200. That's almost half. All it took was a phone call and asking the right questions. Even if the discount isn't huge, it's better than paying the full amount without asking. And over time, negotiating becomes easier. You gain confidence, you understand the process better, and you start seeing that the system doesn't have to control your finances. It's something you can take charge of. Remember, this one tip is often the fastest way to save a big chunk of money. It's simple, powerful, and something almost anyone can do. So let's quickly recap what we've covered today. Medical bills can be confusing, frustrating, and sometimes downright overwhelming, but you don't have to feel powerless. The key steps to take control are simple. Understand your insurance so you know what's covered. Review every bill carefully to catch errors. Negotiate directly with providers. Shop around for care when possible. Use preventative services to avoid bigger costs later. Take advantage of tax savings with HSA or FSA accounts. Check out assistance programs if you qualify. Each of these steps might feel small on its own, but together, They add up to hundreds or even thousands of dollars in savings every year. And the best part? They also give you peace of mind, reduce stress, and help you make smarter choices for your health. I'd love to hear from you. Have you ever successfully lowered a medical bill or found a trick that saved you money? Share your story in the comments so others can learn from your experience. And if you found these tips helpful, hit the subscribe button and turn on notifications. That way, you'll get more practical advice every week to protect both your health and your wallet.